So we've been working in collaboration with a number of colleagues in Nepal now for getting on for 15 years. So Nepal is a low-income country which has not got the resources that the UK has, and it has a large burden of people with chronic respiratory diseases and long-term lung conditions. So what we've been trying to do in a number of initiatives is set up additional studies to find out how common lung disease is in Nepal, and also to look at the risk factors for developing lung disease, which are quite different from those that you see in the UK. And because it's a different environment from the UK, we actually learn quite a lot about the disease itself. It started more or less by chance, in that I happened to be at a meeting sat next to the person who was then dean of the medical school at Dhulikhel Hospital, which is associated with Kathmandu University. And we got talking, and he said, come over and have a look and see what we're doing, and we'd be very interested to talk to you, particularly about lung diseases. And so I did. I managed to get a small grant to go over there, and everything really stemmed from that initial contact. But the challenges of working in what's a sort of low-income, particularly in a rural environment, are quite considerable. So, just the simple things like going to an outreach clinic, if the weather's bad, a journey of 30 or 40 miles might take you 5 or 6 hours. And on one or two occasions I actually had to get out and walk alongside the vehicle because it was quicker than driving. So there are some logistic challenges which are partly due to the geography and the climate. And of course the other issue is that there are some extremely able people in Nepal. The resources that exist are less extensive than we'd have in the UK. So the amount of work that's needed to build up collaborations, the capacity building element of it is somewhat larger than you'd have if you were trying to run a similar study in the UK.
So in Nepal, there is the lung health challenge is a significant public health challenge, because as you know, air pollution is one of the biggest contributing factor for lung health. And in Nepal, air pollution, both ambient and household air pollution, is the biggest problem. So I read one article this morning. So Kathmandu, as the capital city of Nepal, is the second most polluted cities in world. People have to cook their food every day. So it's not like here that they have an oven or the microwave where they can just make the food easily, but they have to combust the biomass fuel every day. So the solution to our research could help them reduce the exposure every day in their everyday life. That could help improve their respiratory health. So that's why the research outcome or the work that we have been doing is very important for the daily lives in Nepal. I'm very excited to carry on this research, not only within the Nepal. Maybe the finding that we find in Nepal could be implemented in other developing countries as well. So I'm really excited to take this forward.
In addition to the benefits that we have in terms of the research we're able to do, and hopefully some of the things that we can do to influence healthcare provision, I think it's been really powerful to have the ability for people from the UK to work alongside people from Nepal. And I think that's a mutually beneficial process. And as I said, we've had quite a lot of visitors from different institutions actually in Nepal come and spend some time in the UK, and people have gone over to Nepal as well. And it broadens the horizons. It really gives you a bigger perspective on how to deal with healthcare issues rather than the perhaps rather narrow focus you get if you just look at how we do things in Nottingham.